Good afternoon, good morning. Welcome to Dutchess County Government's Diversity and Inclusion Black History Month virtual lunch and learn. My name is Josine Anderson Tejeda. I'm the Equal Employment Opportunity and Inclusion Officer for Dutchess County Government. Today in my role, I am the lead for the Diversity and Inclusion Committee, and we have a couple speakers for you. It's an informational session as well as resource sharing. So you saw the press release. Our first speaker today is Dr. Kimbrough, has vast experience in diversity and inclusion, over 17 years. I don't want to repeat what she might say, but we want to welcome you to today and thank you for being a valued resource offline, as a lot of the diversity and inclusion county representatives, get together collectively and just try to share best resources, best practices, and just support each other and check in. So having a community within a community is what is needed and is grateful. So without further ado, we welcome Dr. Kimbrough to our session today.
All right, well, hello everyone. Good morning, and thank you so much for having me today. I just want to pull up my screen for you all, so give me 1 second to do that.
Oh, Dr. D, you're on mute.
Okay. All right. So as it turns out, when you're sharing your screen, you have to you get muted, then you have to unmute yourself. Okay, I got you. All right. So yeah, over the last 17 years, been working in organizations to cultivate change around DEI leadership and culture, also in government organizations, just like yourself. I worked at Monroe County most recently as the Chief Diversity Officer, and also lead the Kimbrough Management Consulting organization, which works with small, mid-sized organizations, government organizations to implement policies and procedures as it relates to DEI. So again, I am so happy to be here today. Thank you for having me. And I really want to give some information around Black History Month, race in our society, and also DEI. So as you see, DEI is popping up everywhere in our society, from our businesses, from our schools, from where we live, from where we shop, all those different things. And a lot of times I think what may be missing is, what does it mean? Why do we even have to have a particular focus on DEI? So those are some of the things I want to explore with you all today. Just some housekeeping things. We know we're not going to have all the answers today. We're not going to solve all the problems today, but I just want to bring some things to your attention or refresh some things that you may already know. In DEI work, when we're talking about race, we're talking about racism, we're talking about the history of African Americans in our society. It can be very hard because it is connected to who we are, and what our identity is in this society. Intentionality is always key around this work, that we do it for a purpose. DEI is everyone's responsibility. So it's not just, it isn't just your DEI committee, it is everyone, from those who are employed by the county to those who live in the community in the county. Always have an open mind. There are no right answers. Be comfortable with being uncomfortable. Give yourself and peers grace, and always speak your truth. So at the end of my presentation, I will give you all the opportunity to ask any questions, provide any insights. That will be fine. I always like to level set with some general information around what DEI is. We know that diversity is all of the differences that exist among us. And we may want to ask ourselves, who's in the room, right? So when we're looking at our diversity of our teams, of our workforce, of our community groups, of where we live, who's there? That's our diversity. And the equity is who needs help getting in the room, and not only getting there, but thriving. So what are the tools and resources that people need to thrive? Also, inclusion. Does everyone have a place in the voice in the room? So once people are in the room, do they feel as though they belong there? Do they have a voice? And then leadership is always key. We all have the ability to be leaders and use our voice around diversity, equity, and inclusion, and ensuring that when we see things, we are pointing them out, we are bringing awareness to those things. So why do we do it? So why do we even need to focus on DEI? And it is really based on our history. As we all know, the way in which our society was built in a way that everyone doesn't have equal rights. Excuse me, guys, I'm getting over a cold. Everyone doesn't have equal rights. So when we think about our civil rights movement, we think about women in our history in regards to rights, gay rights, discrimination, stereotypes, all of those things in our history and the foundation of our country is why we take a particular focus, why it's necessary that we focus on things like DEI, and we focus on civil rights, we focus on things like discrimination and starting to mitigate some of those ideologies that are associated with those things. There is a modern context. DEI isn't new, or the fight for human rights to reduce discrimination. Those things aren't new. Those things have been happening since the start of this country, but it does have a modern context today, and that's where DEI comes in. It is that modern frame around the work. And also, we've seen since 2020 that renewed energy, that renewed awareness around DEI, around discrimination, and how it impacts people, different groups, particularly African Americans. We see more willingness to understand the differences between power and privilege, and the consequences of those. We've seen the Black Lives Matter movement, the Me Too, Stop Asian Hate, the renewed social awakening, and then all the isms that happen every day, and us being able to address those things. All right, so our goals. I think that no matter who you are, or where you are in life, what your background is, I think we all want the same thing, and that's equal opportunity, right? So when we talk about equality, it's meaning that different people don't have access to the same things. Some people may have access to some things and some people may not. It's unequal, right? The playing field is not level. When we speak about equality, that means that, okay, everybody has the same thing, right? But everybody may not have the access to the tools in order to get that equal distribution. So that's where equity comes in at. It's so not only giving people, we can see here in this depiction, equality is giving everybody the same thing. Everybody has a ladder, everybody can reach, right? But everybody doesn't have access to the same tools and resources. When we look at equity, we start to see giving people a little something different, a little something more based on what they need in order to gain access to that equality. And when we are really, really getting to the root of what we want to get after, we want to get after equality for all, we want to get after justice for all, we really need to look at fixing the system. And we can see that there in the bottom quadrant there around justice. So not only giving people what they need in order to access the tools and resources to thrive, we change the system, we affect the system, and we create it in a way where everybody has equal access and opportunity. So I think that as a society, we're getting around to that equity phase. People are starting to understand what equity is, what it means in policies, what it means in systems, what it means in processes. And we want to be at that justice stage where we're actually able to fix the systems that limit access and opportunity for particular groups of people, particularly African Americans. So what gets in the way of us getting to what we all want, that equal opportunity, access to tools and resources, is racism, right? And we all know what racism is. And it really is those things that limit access and opportunity based on who you are in society. We can see it in institutions, practices, and policies that limit access and opportunities, structural, so the way in which organizations, institutions, and policies in our society is designed, interpersonal, so the way that we are communicating with each other. So that's where those microaggressions come in, those stereotypes and those things like that, whether they are blatant or whether they are very small things that happen every day, those microaggressions, but the way that we communicate, how we feel about each other, how we are interacting with each other. And then it's also internalized. And we see that a lot as well, just based on the messages that are going around. We start to develop that self-hatred based on who society is telling us that we are. Okay. And some of our biggest barriers to breaking down racism is our mindsets, right? So our mind has the ability to take in 11 million pieces of information per second, but the brain is only consciously aware of 40 pieces. So when we think about the media and we think about what's in the news and we think about things like bumper stickers and all those different things, the different forms of media, communication, and the narratives that are attached to that, those things develop our mindset, whether we are doing it consciously or subconsciously. And when we are creating that mindset, especially around things we are less familiar with or people that we are less familiar with, it goes into our subconscious mind. And when people are making decisions, for example, someone who has had limited access or limited engagement with people of color, they can develop these mindsets based on a lot of the information that has been coming in, whether it is communication from your family and friends, but maybe not your own experiences, but the mindset or the ideologies that have been perpetuated to help you develop a biased mindset or a mindset that is focused on stereotypes. All right, so our social identities are attached a lot to that narrative that is created around people, those stereotypes that we see every day in the media. Our social identity is the narrative behind behind what society tells us who we are, right? So who we are based on society, based on our biological differences. So when you look at this wheel here in the middle, it'll tell us what it means to be a person of color, an African American person, a woman, maybe someone of a Hispanic heritage, someone with disabilities. So it kind of tells us and set that expectation, not only for those around us, but for ourselves. And we usually don't start to understand our social identities until we get out into the world, right? Until we step into school and people are telling us, well, you are this, and this is what this means. And, I think a lot of times, especially in our younger years, we have that aha moment like, oh, I'm different. Oh, I'm a person of color. Oh, because at home, everybody's the same for the most part, or commonly, not always. But, those differences don't start to really take into play until we start to interact in society. All right, so I want to take a moment to kind of give you, show you this video and kind of show you how these things may take shape in our everyday experiences.
If you think you know what happens next, ask yourself why. These are the Black stories we've been shown. A narrow view that limits our understanding. But there's so much more to see. The full picture of Black life. Let's widen the screen so we can widen our view.
Okay, so that video just kind of shows us some of the stereotypes that happen every day in society, and there's consequences attached to those stereotypes for people that look like those people that look like us, Blacks in America, just based on the mindset that people have, when in actuality it isn't true. A lot of the times it isn't true. So narratives around Blacks in America, some of the things you've seen in that short clip: lazy, criminals, single mothers, broken homes, poor, violent, uneducated, dangerous, ignorant. So those are some of the things, and I think we have either witnessed at least one of these things or experienced at least one of these things in our society, and we see it perpetuated time and time again. In the news, we see people of color, Black people, Black men losing their lives because of ideologies and narratives around, Black people, and they're criminals, they are uneducated, unworthy, what have you. But we constantly see these things pop up in our society, and we've also seen the consequences attached to them. That's why it's so important that each of us take the opportunity to change the narrative around Blacks in America. Going the wrong way. All right, so one way that we can do that is really understand some of the contributions. I mean, America was built, African Americans have built the foundation, or Blacks, or through slavery have built America's foundation to make it what it is today and what it has been historically. And I think that's one thing we always have to keep at the forefront of minds. A lot of times, things around the contributions that African Americans have made to America, we don't see those in textbooks. They are not taught in schools. However, these things are important because it lets us know how powerful we are, that excellence does lie in our blood. So we have been inventors forever, since the inception of this country, with the invention of air conditioner by Frederick M. Jones, peanut butter, George W. Carver, doorknob and doorstops, our Osborne Dorsey, telephone transmitter, Granville T. Woods. So some of the things that we use every day and we all take advantage of, those have come from, the minds of Blacks in our society. Doctors in modern health, first Black licensed physician in America, Dr. James McCune Smith. Blood transfusion storage, Dr. Charles Drew, which may come up again later. Performed one of the first open heart surgeries, Dr. Daniel Hale Williams. So, we have had major contributions in education as well, developing the first Head Start program. And many of us may have even been in that program and helped jumpstart our education. Edmund Gordon overturned segregation in public schools. Thurgood Marshall with the board versus Brown versus the Board of Education. first African American Studies program, Nathan Hare, in 1968. So again, there has been, and there's tons of them, and you all, had some of those already put up at the beginning of this presentation around entertainment, sports, politics, journalism, so many things that aren't always put at the forefront of our media. We don't always see it in movies. We don't always see it in TV shows. It isn't taught in the classroom. So the only thing that people are really gravitating towards is those negative images, those stereotypes of Blacks, when we've done so much and we continue to do so much to make our society what it is today, and the ability to continue to thrive the way that America does. And it couldn't be done without African Americans. So some current legislation protecting our Black rights. So one thing that we want to do is make sure we always know what our rights are, educate ourselves around our rights as African Americans. We are a protected class, protected against discrimination and harassment. However, a lot of us don't know what our rights are. So I think it's always important, and there's tons of legislation attached to race. But these are some of the most current ones, which we all know, the Civil Rights Act, which was marked as a milestone in a long struggle to extend the civil rights. And this is something that we are still battling today. Just that African Americans have legal rights in this country. And it wasn't that long ago, 1964. I mean, that's in our lifetimes. It's not like it was 100 years ago. It's only about 60 years ago. So it is either in our own lifetimes, it is either in our parents' lifetimes, grandparents, what have you, depending on your age, but it is within our lifetimes. Our voting rights, and we still see this today. And as a government structure, these are probably a lot of things that you all are dealing with, but the voting rights, the fair housing rights, the Crown Act is something that is also new. In regards to our hair and the way that it grows, we know that there has been communication, there has been narratives around being unprofessional because you have natural hair, right? Or not getting a job, or, microaggressions in the workplace because of our hair, whether it is natural, whether it is dreaded, whether it is braided. And there's protections against that in certain states. I'm not sure if this has become a federal law, but I know many states have adopted this law. And more recently, American Rescue Plan, and this is probably something that you all are dealing with as well, the ARPA dollars, in order to increase equity in our societies. All government agencies have been given the opportunity, funding and the opportunity to address and impact systemic racism. So these are just some of the things in our legislation that are growing to protect our rights, but we also have a voice. And where do we go from here? We start to change the narrative. We start to communicate differently. We check our own biases. We learn what our roots are. We use our voice wherever we go. I know that it is very hard in certain situations, whether it be at work or what have you, to use your voice, but we take the courage in order to do that, because it is just so important. We practice anti-racism and promote that. And what that means is that we are not silent around racism or racist acts. We become vocal around that, and we promote that, and also expect that of those that we engage with. We grow our mindset, so we continue to learn about ourselves, learn about different cultures, learn about our laws, understand our own biases, and always advocating for resources. Okay. So I know I didn't have enough time here, but I wanted to kind of give you all that information. Also, Josanne will put in the chat, I do have a free training available. So if you're looking to gain more resources, more information, there is a link that will allow you to do that. But always remember, Black is beautiful. I'll open it up for maybe a minute or two for questions, because I know we have another speaker. But thank you. Thank you for having me today. Okay. Any thoughts or questions?
I don't see any questions
I
in the
got a
chat
question.
yet.
I-
Okay,
I'm-
David, there's a,
Am I unmuted? All right, good. Thank you, Dr. Kimbrough. Thanks for coming. Thank you for your presentation. It's very interesting. I just have a quick question. When you say advocate to resources, like,
Mhm.
could you specify some things? Or what does that mean?
Yeah, absolutely. So in your workplace, there may be certain things that people may need in order to thrive, and it may be based on the differences that they have, whether it be race, whether it be disability. Is it flexibility in time? Is it, FMLA, or, whatever it is that people need in order to thrive, advocating for those resources. And if it isn't you, it may be someone else, but making sure that whoever needs to know knows that those resources need to be allocated, whether it's workplace, whether it's school, whether it's in your community, whether it is dollars, whether it is funding within your power, advocating for the things that you can.
All right, thank you.
Does that make sense?
Huh? Yeah,
Does that
yeah, it
make
does. But just quickly with a follow-up, like,
Yeah.
there's so many different avenues, you know what I'm saying? Like this person needs one thing, somebody else. And yeah, I was thinking about like any suggestions or strategies you have to like, streamline it or bring it in under an umbrella thing. Because yeah, everybody got, slightly different interests and aspects.
Absolutely. I agree 100%. And you can't solve it all at once, right?
Right,
So definitely choosing that lane, joining the committee. I don't know if you're on the DEI committee at yeah. So joining that committee and really setting forth those initiatives. These are the things that we're going to do this year. We're going to get this accomplished. Next year, taking an inventory of all the things that need to be done, and then just really planning to say this is year 1, 2, 3, 4, 5, and being committed to that and getting it in front of the right people.
Thank you.
Mhm.
and to piggyback off of that, on Dr. Kimbrough, can you just like briefly share some of the highlights that your office did in your county as you were the lead DEI person in your county, just so we can get some inspiration, just some blueprints as well.
Yeah, absolutely. One of the biggest things that we were able to do in the county is work with each department. At Monroe County, there's 23 different departments. So working with each department to develop their own diversity action plan. So making sure that all of the leaders, so those who are making the department heads, making the decisions for their departments, had an idea of what diversity looked like in their organization, but also their tools and resources, and also action steps that they'll be taking, whether it is internal to the organization or in the community, which looks different for every department, because we had health and human services, we have a hospital, we have a law enforcement agency. So making sure that the leaders are instrumental in knowing what DEI is, how it impacts the work that they do, and they're also active again in reducing or mitigating the impact of marginalization. So I think that was one of the biggest things that we did. We implemented a leadership development program for people of diverse backgrounds. We did education and training monthly, so different topics monthly, just like you guys are doing here. We did countywide training and development. We updated policies around hiring and processes, so the way in which people were hired into the organization. And we reformatted our employee equal opportunity, so EEO complaints, employee relations. We reformatted that and created an alternative resolution process where people could, instead of filing a complaint as your last resort, you come in, you have a conversation, whether it's mediation or just really understanding the issues, and we would work to open the lines of communication and help people come to some understanding before it gets to, okay, well, I need to file a complaint. So those are some of the things that we did at Monroe County.
Thank you. Sounds good. A lot of proactive measures there. We might have to have you come in as a smaller group with the committee and just, pick your brain a little bit more. But thank you so much. I did drop your link in the track for the in the chat for the training. And I'll just keep monitoring throughout the presentation if anybody has any additional follow-ups as we go to our next speaker. But thank you so much and
Thank
for
you.
joining us today.
Yeah.
And next we are going to be speaking with representatives from the American Red Cross. They have a lot of community resources and they wanted, this was important for them to come share what they have for the community. So I'm gonna have Executive Director John Vail introduce our speaker, if that's possible, and I will make the co-host possible for the presentation.
Great. Thank you so much, Hussein, and the rest of the folks here on the call today. I'm John Vail. I'm the Executive Director for our Hudson Valley chapter of the Red Cross. So when I had met Hussein, it was at our Orange County Human Rights Conference a couple of months ago. And we were just kind of chatting about some of the work Red Cross was involved with here in our communities. And one area where, again, we really find, I think, a powerful connection with our communities is helping deliver life-saving blood. And it's something that I think when we look at the grander picture, it's something that us, to fulfill our mission to alleviate human suffering, is something that's so near and dear to us. And we know there are a lot of impacts, whether we know folks who have had cancer or suffering from a very specific disease today that our blood account manager, Susan Summer, is going to speak to, which is the sickle cell disease. So I'm going to hand things over to Susan. We're going to run through a quick little presentation ourselves, and we'll leave a little room for any questions afterwards. But again, we just want to thank Hussein and the rest of our attendees here today for helping us include us as a part of this conversation. And we just want to recognize some incredible contributions to our organizations from Black Americans. So Susan, over to you.
Okay, hi. Thanks for having me on. I got to tell you, Dr. D's presentation was very eye-opening. I appreciated it a lot. I don't know, can you get my slides up, Josanne, or?
Sure, I also made you co-host, but let me try
Okay.
to put them up for you.
I'm just gonna wait a second for the slides, but we're very happy to be included as part of this Black History Month. It really is a time to honor the achievements of significant Black Americans. And the Red Cross has a theme for Black History Month called Black Excellence is in Our Blood. So I want to get into some of the ways that the Red Cross early on has had several great Black Americans who have done tremendous things, especially considering the time that this happened. The Red Cross was always very open to including Black Americans, African Americans into our community and help the Red Cross grow. If you want, Josanne, I can pull it up on my screen and share it if that's easier.
Sure, yes, I made you co-host.
Oh, you did?
Yes.
Okay, so how do I get the screen, the slides?
I'll just do it. I have it here. 1 second.
Oh, okay, great. Sorry. Oh, you were, sorry, I got confused. I thought it was some way for me to do it. Sorry, guys, about the technical difficulties. Oh, beautiful. Thank you so much. So just gonna, can just go to the next one. So the Red Cross's mission is to alleviate human suffering. And here's some fine individuals who've helped with this over the years. I know Dr. Kimbrell mentioned Dr. Charles Drew in her presentation, but he was really a remarkable human being. His work with the Red Cross helped save the lives of hundreds and thousands of soldiers and civilians during World War II. And his efforts to increase the blood supply led to the use of blood mobiles and other collection, preservation, and distribution processes that we still use today. And Dr. Drew was an advocate for equality and excellence in medicine. He challenged the military's policy of segregating blood and plasma products by race. And through the collaborative support of civil rights organizations and the Red Cross, the government later discontinued this practice. Next slide. Dr. Mary Leonard Bethune, she was a wonderful civil rights activist and leader. She also, She also, like Dr. Drew, advocated for the desegregation of blood collection practices, and she hosted blood drives and encouraged African-American women to staff canteens. And during World War II, she served as director of the Florida chapter of the Red Cross, helping to build bridges with the Black community. She advocated for employment opportunities, disaster relief, and diverse representation on Red Cross regional and national boards. Okay, next slide. And Dr. Jerome Holland, he was the first African-American chairman of the Red Cross Board of Governors back in '79, and he championed excellence in blood services through innovative technology, which resulted in increased blood donations and research of hereditary diseases, which leads me into my next slide. So, and then the next one. Sickle cell disease. The Red Cross 3 years ago took on sickle cell disease as a organization-wide initiative to try and help alleviate suffering associated with this disease. I'm not sure if everyone's aware of it, but it's one of the largest disease. It is the most prevalent genetic disease in the world and in the United States. People who suffer from this horrible disease, their red blood cells are not soft and oval, but they are hard and sort of crescent shaped, and they get stuck. So they get stuck a lot in extremities, in organs, and it's an extremely painful disease. The Red Cross has made it our mission to try and educate people about sickle cell disease and to also try to get more people to donate blood to help with people, help people who are suffering from this disease. Next slide. So if you're not aware, sickle cell is a lifelong disease. Patients, in order, because of the way the red blood cells are formed, need to have treatment by having blood transfused. Some people might need only regular transfusions to replace a little bit of blood every now and then, but in severe cases, they might have blood transfusions every other week, monthly, and as it says on the slide, some people receive up to 100 pints of blood each year. Next slide. So it used to be that people with sickle cell disease weren't given a very long life expectancy, and the life that they were given was not a very fun one because it involved a lot of pain. Not only pain, but you start to lose the ability to breathe. You have to be on oxygen. You may not be able to walk. There are so many horrible aspects to this disease. The reason I'm bringing it up during Black History Month, but I personally bring it up every day of the year, is that there are over 100,000 people in the US who have sickle cell disease and are struggling with it. And it primarily does affect African Americans. And as you can see, the statistics for New York are a little higher than average for the country. So I'm very proud of the initiatives the Red Cross is taking in New York to try to increase the number of African American donors. Next slide. And the reason I'm looking to increase the number of African American donors is that it has been determined that although ethnicity doesn't make a difference for most reasons for a blood transfusion, it's found that people with sickle cell, if they receive donations of blood from someone of a similar ethnic background, they have a much better prognosis in the long run. Right now, because of the low number of people of African American or Black ancestry who donate, we are not able to meet the entire need for helping with sickle cell patients. And so I don't know if you see right there that although 13% of the US population is Black, less than 3% of Red Cross blood donors identify as African American. So there's a couple of things. One, not everyone identifies themselves when they go to donate blood. So I'm asking that when people do go to donate blood, they could please check their race, because it's not just sickle cell disease, it's also other genetic diseases that they are finding that if someone gets blood for from someone of the same ethnic background, they have a much better prognosis. And the second thing is, I know that the medical system in the United States has not always been a great place for African American people. It's there, as we were talking about before, with the desegregation and also some of the, like the Tuskegee testing and the Henrietta Lacks and all different kinds of things. A lot of African American people are very hesitant to get themselves involved in the medical system. But I hope that people can trust what the American Red Cross is doing and help us to please come out and donate, no matter what your thoughts are on the past and what has been done to African Americans through the medical system, because the Red Cross we are really, really trying to increase the number of people who have an ethnicity that matches our sickle cell donors, to provide them with the best possible solution for when they need a transfusion. And next slide. So that's basically what I'm asking for. I know many, many people who suffer from sickle cell disease, and they tell me the physical pain is just awful. It's like having nails driven into your bones. And when you donate blood, your one donation can help up to 3 people. And I really hope that you can not only share information about sickle cell disease, but also share information about why donating blood can help people who are suffering from this disease, but also so many other diseases and traumas and transplants and childbirth complications, and so many other reasons. So please donate blood. Next slide. And this is how. You go to redcrossblood.org, you enter your zip code. We have lots and lots of blood drives in the community. When you find a drive to donate at, just set your appointment up. When you end up going to donate, please, when they ask you for your race and health history, please give it. And I always like to close out by saying that when the Red Cross does surveys of people, why don't you give blood? They say because no one ever asked them. So I'm asking you to please go out and ask others to donate blood and try to help people in our community. Thank you. And I'm glad to answer any questions anyone might have.
Thank you, Susan.
Right, well, thank you. And please, please donate blood.
I'm trying to see if there's any questions in the chat.
Okay.
May I ask what the Red Cross has done to ease those fears and inspire confidence in those Black Americans who are distrustful of the medical field?
We are completely transparent. If you want to know what happens to the blood, well, for instance, with your blood, if you donate blood and you sign up for our blood donor app, you'll be notified when your blood arrives at a hospital. So you get that. Because of HIPAA, we can't tell you specifically what's being done with your blood, but we let you know if your blood, for instance, if you donate blood and something goes wrong, like midway through the collection and we can't collect a full pint, we do have paperwork that tells you all about how it's used for medical research and what's going to be done with it. But the number one reason we collect blood is to give to hospitals so that they can give it to patients to help with diseases. I don't know if cancer patients receive blood, and we really don't have enough blood to give. So there's really nothing else we could be doing with it. We need to collect at least 13,000 units of blood every day. Every 2 seconds, someone in America does need blood. And we are charged with our blood going to hospitals so that it can be given to patients. And that is our mission.
And Susan, I had a question in regards
Sure.
to who is ineligible to give blood. I know throughout the years, sometimes I've heard that if you're anemic, you can't give blood. So just so people can know that, they can if they heard something incorrect.
Sure. So there's been a lot of changes over the years for blood donation. When you come, we give a mini physical. It's basically we check your temperature, your blood pressure. We take 1 drop of blood to check your iron levels. So we want to make sure that we're as kind to our donors as we are to the patients who receive the blood. So if your iron is too high or too low, we will let you know, but we will not be able to take your blood that day. But a lot of people think they can't donate because they have diabetes. They can donate as long as your sugar levels and you're feeling fine are good that day. If you have high blood pressure and you're taking medication, you can absolutely donate blood as long as your blood pressure that day is in the range. If you have a tattoo, you can donate blood as long as it's been 3 months since you had that tattoo. You can go to our website, redcrossblood.org. There's so many different reasons that you can give blood. We also have a hotline if anyone ever wanted to reach out to me, or they can chat through our website where you can talk to a person and ask your specific concerns. Like if you're worried about some travel you've done. Most places you've traveled, absolutely fine for giving blood. But sometimes there's a malaria outbreak in certain areas and you can't give blood if you've been there within a certain amount of time. But even people who have had cancer, as long as it's not a blood cancer, if you're 1 year free from treatment and from symptoms, you can donate blood. So things have changed a lot, and it's continuing to change every day. And more and more people are being allowed to give blood. The rules do not come from the Red Cross; they come from the FDA, and we have to follow those. But we work and advocate all the time to try to get to open up the number of people who can donate blood. So I'm really happy about that.
Yeah, I have a question.
Sure.
Yeah, what is the position of the Red Cross in regard to the LGBT community?
Sure. So the Red Cross, we are open to everyone, and we will provide blood to anyone, no matter anything, LGBTQ, anything. When someone comes to donate blood, they are allowed to identify what they are. We do not insist on anyone identifying as binary. The other thing we do is we basically there is one big thing. So the FDA had a males who've had sex with males deferral. It used to be a lifetime deferral, and it's based on the 1980s AIDS epidemic. About 2016, they changed that to a 1-year deferral. In 2020, they changed it to a 3-month deferral. In the meantime, they've done something called the ADVANCE study, which is, it took place in many large urban areas, and the FDA asked people to come and be part of the study. The ADVANCE study just ended, and the FDA has taken their findings under advisement, and I'm hoping by the end of this year, the male sex with male will no longer be a deferral based on a person. It'll be based on activities and behavior, but they're in the process of working on doing that now. And I have no control over the FDA, but the Red Cross helped with the ADVANCE study, and we continue to advocate to make whether or not someone can donate blood based on their their behaviors rather than who they are. So that is something I'm looking forward to. And the FDA has come out in the last week, I believe it was, and said that they are going to be making these changes. They just need to do a public comment section, public comments period, and then they'll be writing up their new guidelines for blood organizations to collect blood. So I'm excited about this. Does that answer your question?
Yes, it does. Thank you.
Right. Thank you.
Thank you for that. And I know we're coming to the 5 minutes of closing. So you did mention that you can put your zip code in to find a location. I do have the flyer of the February blood drives that John shared with me. Thank you so much, Susan. So in our wrap up here, John, would you be able just to share some of the additional resources that the Red Cross has for the community? And I know we're looking for diversity of blood, but also what other resources can residents of Dutchess County, Hudson Valley, New York State, the world receive from the Red Cross, and how could we partner in this mission?
Sure. And again, thank you, Josine, for that little segue. In addition to collecting blood, Red Cross, we do respond to disasters every single day. So every 8 minutes across the United States, a home has a disaster, most frequently a home fire. So we offer a free service to our community members. We want to keep everyone safe. We don't want folks to suffer needlessly. So anyone who is in need of either a free smoke alarm or home fire safety education, our local Red Cross chapter is happy to come to your home and provide that service completely free of charge. No needs assessments. It doesn't matter whether you own or rent a home. We are happy to come to your home and provide this service for free. I think I provided that flyer, but I can send it over again so folks can give us a call. Again, we encourage everyone to take advantage of this. And just like telling folks to donate blood, please tell your friends, your families, groups that the service exists. We don't want to show up to your home after a fire. So this allows us to get out there, make sure our families are safe, especially in communities we know where we see large incidences of fires. And this time of year is also our busier season as folks start to use their heating appliances. And unfortunately, we do see an increase in our home fires. Red Cross, we can also offer some other free preparedness services to our communities. We offer several youth preparedness programs. So if you are a member of a youth group or the school, we have several programs. They're really great. We get our kids thinking about how to be prepared for emergencies. And if you have children, you know that they're incredible advocates. Us adults, sometimes we don't take our own safety very seriously. And we hope to, again, start building a culture of preparedness from a very young age. So Red Cross can offer that service for free as well. If there is any interest, I'll drop my contact information in the chat. We'd be more than happy to talk with you to see if there's a way we can set up a presentation in the near future. We do also offer, CPR, first aid, AED training. That is typically, your paid certification course, but we are happy to also offer a hands-only CPR training, which will not get the certification. However, we're really trying to teach our community members, our individuals, our families, how to perform life-saving resuscitation. It is our hope that we never need to utilize these skills, but we do want to be prepared. Unfortunately, folks who do not receive CPR within a timely fashion, the expectancy to live is reduced with every second that passes. So again, another free presentation we can offer you. If you have a group or a business organization that could benefit from it, please reach out to us. We want to work with you and help make sure everyone remains safe. And as always, we are looking for additional volunteers to join our ranks. We have a lot of great work going on here in the county, whether it's going to be staffing one of those blood drives that Susan's going to be organizing, or some of these free preparedness trainings, or going out there to respond to disasters, not only here in New York State. We do send our volunteers all over the country to respond to disasters as the needs either grow in size or scope or complexity. So again, we really do rely on that power of our volunteers. We are a nonprofit humanitarian organization, really just geared towards alleviating human suffering. And we know that there's all too much suffering going on in the world today. So if you're looking to make a positive impact, we could use you here on our team. So I'll leave it at that, Justine. And again, thank you all so much for including us as a part of today's conversation. Thank you, Dr. Kimbrell. I look forward to connecting with you as well to help again improve our organization's standing in our communities. Thank you.
All right, John, don't go yet because we have to include everybody. So what about our veterans?
Oh, thank you. Yes. And look at that. I've done my job working with Justine. She's even calling things out that I missed. So we do also offer a line of service to our armed forces. Actually, Red Cross was founded on the battlefield during the Civil War by Clara Barton. And what we do is we provide emergency communications between our deployed service members and their families back home. Typically, these are done during times of severe illness, sometimes deaths within families. Our Red Cross can help verify information and get our service members back home. So again, sometimes our service members know us for that reason, and it's not always the best reasons, but they're incredibly appreciative of that level of service. We do also provide resiliency workshops for our military families. So spouses who will be remaining home while their loved ones are deployed. We do provide trainings and services to those families to make sure, again, we can build resiliency within our military families and our communities here. We also do have representation at the Castle Point VA Hospital. Again, we just look to alleviate human suffering wherever we can see fit. And we know our service members, our active service members, veterans, are going through a lot. We want to make sure that they have that connection. So we've also established a hero care network that any veteran can call into and get information, referral support. So in some instances, some emergency financial support is available. But again, we just want to make sure folks kind of know what we can provide. We do a lot of work, so it can get a little confusing sometimes. So I will drop my information in the chat. And if anything that was brought up today, if you have any additional questions, please reach out. I'd be more than happy to explain a little bit more.
Thank you, John. Thank you, Susan. Thank you, Dr. Kimbrell. On behalf of the Diversity and Inclusion Committee in the community, we just wanted to thank you for sharing with us today. I did drop some links in the chat that tie into the discussion. One of the organizations that deals with sickle cell warriors that they call people that go through crisis with sickle cell is called Life Flows Through Everybody. They have meetups for parents who have sickle cell with children. Also, just anyone who's dealing with sickle cell, just a support group, as well as resources to the hospitals. It's a lot of information. The founder, her father has sickle cell, she has sickle cell, her son has sickle cell, her son's father has sickle cell. So even when you're dating someone or just getting to know someone, just asking them, do you have sickle cell? Because it can make a difference in the life of your children. Constantly in and out of the hospital, constantly, infusions. And then being hydrated is one thing that can help people avoid crisis in sickle cell. Staying hydrated is one of the things that can alleviate some of the hospital visits. And I also dropped some, the Dutchess County government chat, the link for our recruitments and exams, as well as our Think Differently 55A program. We currently have our seasonal student worker available, and you can check out all the links in the website. So thank you so much for joining us today for our presentation. And if you have any questions, you can reach out to Human Resources at any time. My email is available as well. Thank you. Have a good day.